A new study shows the popular weight loss drug Wegovy seems to provide more health benefits for people who have diabetes and a common kind of heart failure. Joining us now to talk about that and some other health topics today is Dr. Bill Hartman, clinical trialist at UW Health. Dr. Hartman, let's start talking about this one first. The news about the diabetes drugs like Wegovy and Ozempic, they keep coming out, and now there's seemingly another benefit here.
Right, the benefits that go far beyond just the weight loss benefits and the diabetes benefits of these drugs. In this particular study, it actually confirmed the results from an earlier study, but it showed that in patients with diastolic dysfunction or their heart's inability to relax fully, to fill up so that it can pump blood to the rest of the body, that Wegovy actually helped improve this type of heart failure. This is a common heart failure seen in diabetic patients. It's a heart failure that really has no treatments up until this point. And one of the interesting things found in this study is that the benefits on this heart failure were independent of the obesity effect or the diabetes effect of the drug. And so it's the first medicine really that has shown to be of benefit in people with this type of heart failure.
That was going to be my follow-up question. Is this because people are losing weight on these drugs? But I guess not. They're kind of separate things.
Right. They're showing that in patients who are relative non-responders in terms of the weight loss with Wegovy, they still get the same benefit the same heart failure benefit as people who are full responders to the drug in terms of the weight loss. And so there's something else going on here. We don't know exactly what it is, but it's very interesting because this provides at least a medication for these people to improve their symptoms as they age.
Certainly good news there. Well, speaking of aging, mammograms, they're something that is recommended for all women once they hit a certain age. But a new study by the CDC finds that some women are still dealing with barriers in terms of their access to them. What's happening here, and can there be a solution provided?
Well, there are social determinants of healthcare here that are coming into play. And women that have decreased transportation, per se, of lower socioeconomic status, women that don't have health insurance, they on average are about 20% less likely to go get these necessary mammograms. There are true barriers here that have to be overcome, but one of the things that could be useful is for people to know that most health insurances, private health insurances, most Medicare payments, they will pay for these mammograms. And so these women, especially in this 50 to 74 age group that was studied, are able to go get those mammograms, and they need to get those mammograms to detect early for signs of breast cancer.
This is kind of part of the annual wellness once you hit to a certain age, right? So a lot of these insurance companies, and like you said, Medicare, I mean, they're going to cover this sort of thing. And maybe people just don't realize that.
Absolutely. And, one thing we know is that people have been dying much less frequently from breast cancer, but Black women and women of a lower socioeconomic status are still more likely to die from breast cancer than people in other groups.
It's all about being proactive. Dr. Hartman, we always appreciate it. Thank you.